Good day, everybody. My name is Vaginal. I'm a psychologist here at Stabilis Treatment Center, working here for the last 25 years. Many people ask me, what are the typical symptoms which we are looking for or looking out for when we are talking about substance abuse? There are numerous of different symptoms which you can look out for. And there's always this massive debate: when do we call it addiction, when do we call it abuse, when is it used? This is all a completely different topic. So I'm just going to give you the 7 most commonly symptoms which I tend to look out for when I look at substance abuse. I think the first one, which we quite often, and I'm going to particularly focus on more so to drug abuse, although it's also applicable for alcohol as well. So the most commonly tendency, it's a change your eating pattern. Vaginal tendency, it tends to suppress your eating pattern. So you'll find these people lose a lot of weight. They would skip meals 1, 2, 3. Some of them would literally even go as far as 2, 3, 4 days without having any form of meal. So a very common tendency which I would tell loved ones is rapid lose of weight. We see that quite often, especially with the stimulants. It suppresses their appetite. The odd exception to the rule is dacha, where sometimes they call it munchies, when they tend to eat a lot like sweets or chocolates. But again, the general tendency is they tend to eat a lot less. The second quite often symptom which I also look out for, it affects the sleeping pattern. So the general tendency is with stimulants or uppers, they tend to suppress, or they tend to sleep a lot less than what we normally would. So they would literally go through a whole night without any form of sleep. They sometimes even go, when we talk about a binge, they would go without any sleep for 2, 3 days. And then they would sleep literally for a day or two. So that's a very common tendency, is that the sleeping pattern are being influenced. The tendency with the downers, like heroin or Nialpe, is they tend to sleep a lot more. So they can literally sleep 24 hours, 2 days in a row. So that's another one which we also tend to look out for. The third one is what we call a babalas or a drugalas. That's when we tend to feel physically ill after a certain amount of time which they have not taken their substance of choice. So let's take heroin for argument's sake. If they have not taken their heroin, literally after 4 hours, after 8 hours, they would start withdrawing from it. That will be typically that cold turkey, that they would be cold, but they would be sweating quite a lot. They tend to have a bit of a shake. Their stomach ache, lower back pain, joints would be sore. So those are typically what we call when a drugalas, but we would feel physically ill after they have not taken their substance of choice. Then the fourth one, which we also tend to see, is the loss of control. Now that means but so many people would say, but I have full control over it and I can stop at any given time. And the typical symptoms which we would see, that they would tell themselves, I'm only going to take 1, and 1 end up in taking 10. Or they would say, I'm only going to use $50, and they would end up using 500 rand. Or they would tell themselves, I'm only going to use up until 10 o'clock tonight, because tomorrow I've got a very important meeting, and they'll end up using up until 2, 3, 4 in the morning. So that's a big one with substance abuse. It's the loss of control, but they don't have control over intake of a particular substance. I think that was the fourth one. The fifth one, which we also see pretty often, is what we call a fix. A fix is when they would use, then they would stop, let's say for 2, 3, 4, 5 hours, and then we would use a substance. It doesn't always have to be the same substance to make them feel physically better. For argument's sake, with cat or crystal or coke, which is a stimulant, it will take them up. But the biggest side effect to uppers is that paranoia, that anxiousness, they can't fall asleep. And then they need to use a fix like dacha or a sleeping tablet to make them fall asleep again. Because they realize that it's 2, 3 o'clock in the morning, the paranoia is really running high, the anxiety is really running high, and they need to go to bed. And then we would tend to use a sleeping tablet, or they would use dacha, or they use alcohol, which is also been a downer. That's why quite often you would find with our drug patients that they will test positive for cocaine and a benzo. And people will always say, but where's the benzo coming from? And that's typically where it's in a calming tablet like a Zanor or a Urbanol, or on a sleeping tablet. So that's a very common tendency which we find with substance abuse. They would use a fix to make them feel physically better. And then negative emotions due to the intake of their substance abuse. And I've already touched on it a little bit. That's typically that paranoia, the anxiety, the depression, because the typical old cliche, what goes up needs to come down. So when they're coming down from cocaine, is that they would feel typically that feeling depressed or feeling sad and feeling low, the lack of energy. That's also something which we see pretty often within our clients. So those are just the common symptoms which you can look out for. But here's the but. When I say these things to loved ones, people get extremely paranoid because they say, but my son or my daughter or my husband or my wife literally got all of these symptoms. And how do I really know? And we never day, people. The easiest way to know is to test them. We can sit for hours and say, but I can see this or I can see that. And every day, my recommendation to loved ones. Test your son, test your daughter. A urine test takes literally 5 minutes and you can get the result. You don't even have to do this within a particular center. You can buy this from any pharmacy. These drug tests. There are so many different variations to it, and it's very simple to read. So to end off, my recommendation at the end of the day to loved ones, if you are concerned, rather test your loved ones, and let's work our way from there. Please, if there's some questions you've got, please ask. All our details at the bottom of this video. You can more than welcome to ask and to contact us. Please take care, look after yourself. Bye for now.